Hi, everyone, and welcome to Doc's Thoughts. So, today I have a very special guest. He is a dentist in my community, and I had reached out to him a while ago, more so based on my own interest in a more natural approach to dentistry. And I was very interested in his website and his practices. I've actually known him for a long time, but I didn't know as much that he had gone into this style of dentistry. So, his name is Dr. Brian Wackwitz. He's a dentist in Green Bay, Wisconsin, actually in Howard, close to Green Bay. He's a graduate of the University of Minnesota School of Dentistry from 2005, which is shortly after I lived there with my first husband, who was a dentist. So I'm very familiar with where you went to school. It's a great place. And then he actually did a general dentistry residency at Meritor Hospital in Madison, Wisconsin. He is certified in safe mercury amalgam removal. He is a member of the International Academy of Oral Medicine and Toxicology, and he has a very, very busy practice in Howard, Wisconsin, as I mentioned, practicing integrative dental medicine, I would call it. And you refer to it as bio-dentistry, which we will get into. And he basically does similar to what I do, where he merges traditional with holistic type care in the mouth. So I'm really excited for this episode. So what we're going to talk about is basically a little bit about you, and then we'll have you describe what bio-dentistry is. We'll talk about oral bacteria and the oral microbiome, which is extremely fascinating, and research is blowing up in that area. How oral health contributes to oral overall health. We'll talk a little bit about like fluoride, root canals, mercury, things you guys are probably interested in. And then we'll finish with some really good take-home points that you can take home and how to take care of your own mouth even before you go to the dentist. So that's enough of me talking. Tell us a little bit about yourself and how you got into dentistry. You can start wherever you want.
Okay. Yeah, the reason I got into dentistry, I guess we have to go back to when I was 13 years old. So I lost my best friend to cancer when I was 13. And that's pretty young to have to figure something like that out. So amidst all of that, I just kind of, realized I got to make this life worth it. And the only way to make it worth it is to serve other people. And, I feel like that's what his life would have been about. And so I felt like I was carrying the torch for him as well as myself, and maybe at times put a little too much pressure on myself to do that. But nevertheless, very motivated to serve others in the deepest way I possibly could. My thoughts were really focused on medicine at that time. And then in the late 90s, my dad was a physician. My uncle was a physician.
Right?
Exactly. Yep. And so my core values really always have been, and the foundation of our practice is that people deserve our time and attention, to be listened to and understood, and then to be engaged in the decisions that affect their health. So give them all the information they need, engage them in that process, and allow them to make the choices with clarity and with dignity. And that's what I learned from my dad, but I saw that he started to have trouble with it as medicine changed. So mergers of clinics, more insurance involvement, which means more administration, more decisions made outside of the operatory, or whatever they call it in medicine, because that's a dental term. But
Yep.
so away from that doctor-patient relationship. And so I started to drift away from medicine a bit, seeing those frustrations, and I ended up working with a dentist that had a very low volume, a specialty practice, a prosthodontic practice actually, and saw that it was still possible to have those sorts of relationships and that sort of autonomy to determine how you engage with other people. So that's really what carried me to dental school. I was incredibly shy, though. I like to say I barely graduated because I was so afraid of people. And then you throw in all the emotions that are involved with dentistry and
Right.
the fears and all of it. It's like, wow, did I really pick the right profession? But I think even today I feel that, I'm a real empath, and yeah, it's kind of hard sometimes to put people through that. But if I reframe it as I'm helping them in the only way that I can, that's where I really find the sweet spot in my purpose within dentistry. So with that, wanting to spend time with people and help them engage with those decisions, I found over time that the people that want to do that are the people that want to take a serious look at their overall health, be proactive with it. And so my engagement with more oral systemic connection and biological dentistry really came from that, is listening to people, finding out what they were looking for, that they wanted to make sure that what they were using, the treatments that they were receiving, were congruent with their overall health and their overall health goals. And along the way, just learning myself, kind of going through my own health challenges and looking for answers outside of maybe the typical medical model, not abandoning it completely for my purposes, but really looking for more answers or more systemic solutions. And so it's really just been a slow evolution ever since.
That wasn't how you first started your practice, correct? So I thought I saw
Right.
on your website that it just didn't feel right when you first started, when you first opened your practice? Because you were practicing just like straight up traditional dentistry, correct?
Yeah, yep. So very similar to the way that we are taught in school as far as a mechanical model. I think I've always been trying to be more preventative, but I didn't know exactly what that meant. I just know that I wanted to slow things down, spend some time with people, and engage them in the process.
So did you have, I think you had mentors that kind of led you through this transition, correct? And it wasn't
hmm
really a huge transition, but just like change in style of practice?
Yeah, yeah. In fact, my first exposure to it was actually not so much the risk to people with silver mercury fillings, but the dentists that were removing them. And they found that that was the root of their health issues. And so that really opened my eyes because in dental school, we're taught like it's baked into the filling like eggs in a cake, like they're inseparable. And
Right.
I don't think anyone refutes that anymore. I mean, we all know that it's released. The controversy, if it is even that, is it enough to cause health issues? And that's kind of the core question. But yeah, it was exposure to other dental professionals that opened my eyes to the possibility that what's in our mouth has a bigger connection with our overall health.
So I noticed on your website that you term the way that you practice biodentistry, which is different
hmm
from the biological dentistry word that I keep hearing in all these podcasts and reading about. So can you tell me a little bit about biodentistry and what that means?
Yeah. Well, we're always tweaking the terminology, and 6 months from now, it might be a
I
little
know.
bit different.
Same,
Yep.
same.
Yeah. Always just trying to find that right word that kind of encompasses everything that we do in our style. But yeah, I think with biodentistry, or I'd say it's an integrative approach to use a term that people are most familiar with. Um, Biological dentistry is kind of this strict practice of well, it's a very strict practice, or can be, but even within that community, there's some controversies, and root canals are one of those. Like the strict biological approach, if you look at some of the bigger biological clinics in the world, like Switzerland or even here in the U.S., you walk in their door and they're going to tell you if you have any teeth that are dead, meaning any that are abscessed or have root canal treatments, you need them out, and you need any metals out of your mouth. Well, that's great if you have $50,000 to $100,000 to spend on your dental care.
Extra teeth to protect your bones and facial structure.
Yes. Yeah, if you have 7 root canals, I mean, you can't remove 7 teeth and not have a compromised function.
I have to tell you,
So,
I had a patient recently who had went to a dentist who practices that way, and she's chronically ill. She has a lot of other
mhm.
things to take care of, but they went right to her mouth and took out all of these teeth, and now she doesn't have enough bone to put implants in, so she's left with like not, she's left with no teeth and not a lot of options for getting new teeth in there.
Yes. Yeah,
It was a
people have,
classic example of
yep.
like
Yeah,
blindfolds. Like you can't just don't just go at the teeth. Like there's other things we can work on.
right. Yep. I've had patients show up at our practice like that, where they just went with no game plan to replace them, just had them all removed, and now they're in our office, and there's very limited things that we can do for
Right.
them.
And
Yep.
they're $50,000 in debt from the procedures.
They already are, yeah.
Right.
And then to try to restore their mouth, it could be a big sum to go forward too.
Right.
So yeah, they're stuck. Yeah, it's tough.
Tell me about, I looked on your website obviously, and there's the Roadmap to Health, which was gums and bone, teeth, bite, and long-term management. Tell me a little bit more about
hmm
that.
Yeah, so that's actually evolved too. We're in the process of redoing our
Oh,
website,
you are? Okay.
updating
So tell
some
me
of
the
these
new part,
things.
the new way.
Yeah. Yep. So the foundation is always gums. So we've kind of just split out gums and bone. Because when we think about bone, it's those deeper infections that we can't see. So does the infected teeth. And with the advent of 3D imaging in dentistry, across the board, we're all seeing more. Not just within a specific focus of dentistry, but we're all seeing more and more abscesses. So those are bigger decisions, but the gum tissue is really the foundation because what's happening there reflects both our gum disease and decay risk. It's the most studied connection between the mouth and the body. And it's also things that we can affect on our own. So if we really want to help people get to a point where they don't have to worry about gum disease and decay again, rather than just repair the damages that are done, just to
Mhm.
allow the disease process to continue, we need to start
Right.
there. So that's always our foundation.
And when you say the gums are reflective of
Mhm.
overall internal health, like you can really see how the patient's insides are in their gums.
Oh yeah, exactly. So a good example is when we made the shift to this style of practice, all of a sudden we'd see people that everyone that was showing up had healthier gums. And so in making those observations, and we do a real thorough charting of plaque and bleeding is our key sign of inflammation and what's going on in the mouth. It's our first sign. And so those bleeding scores, even if people had quite a bit of plaque, their bleeding scores were better And what we over time learned is that they've been doing some work on their gut and systemic
Mm-hmm.
inflammation.
Mm-hmm.
So we recognize that that is a huge piece. So we're not just interested in teaching people what flows from the mouth to the body, but also really emphasizing that it's important to work with someone like you to help them get that foundation for gut health in place if they want good dental health.
Absolutely. And I want to talk a little bit about stuff in the weeds a little bit, and this is more for the audience, so this might be boring for you. Um, but I talk about oral bacteria. So, the strep mutans, what that does, why it's so bad for our teeth, how that causes cavities. Tell me about
Mhm.
that.
Yeah, so strep mutans is kind of the most studied bacteria that has caused decay. Decay is a big puzzle. That's a hard one because there are so many different species. We don't fully understand what sort of makeup of the microbiome truly affects it. And it can be very different from person to person. So, and I think that's why it's so easy to just say slap some fluoride on it and forget it because it can be really difficult to try to solve that riddle. Gum disease is the more studied one and maybe more clear cut. We know basically that there are five keystone pathogens that if they're present, people are going to have issues. And those are the ones that are studied and showing up in the walls of the arteries and aneurysms that cause stroke and all over the body. So gum disease bacteria, we know from a systemic standpoint, decay is a recipe that we really have to work one-on-one with people to resolve, especially if we don't want to turn to, just that blanket approach of fluoride and lectures on brushing and flossing.
Right.
So yeah, there's a lot of factors there.
Do you think you can change your oral microbiome with things like xylitol? Are you a believer in xylitol? For my audience, those are gums or
Yeah.
mints you can chew after you eat that will basically kill that strep mutans and possibly other bacteria.
So my thinking on this is shifting as we speak because we have new tools. So there's a company, and this would be a great resource, and if we can somehow provide a link, that would really help people.
Yeah, I
But
will for sure.
yeah, yeah. So it's called Bristle Health. I think it's
Yeah.
bristlehealth.com.
So I bought one. I'm just waiting.
Yay.
I haven't done it yet.
Good. They're an amazing company, not just because of how comprehensively they measure the microbiome and all the different all the different species. I mean, not just bacteria, but amoeba, candida,
They do candida. That's great.
yeah, yep. So it's amazing, and they're transparent, meaning they're learning in real time too. They're looking for the patterns. They're both at the cutting edge, but they're not just in some lab doing this in isolation. Like they're sharing information that can help people be more preventative as things roll. So it seems like every time I go into the portal to look at a report, there's new insights, or they've tweaked something in a good way. So it's an amazing tool, and they really are at the cutting edge of all of this, and that they can provide more personalized recipes.
Yeah, and I'll put
So,
the links. I don't think either of us are affiliated with that company. I'm just putting that out there, but I'll put the
mhm.
links for it in the show notes. And it's literally just, I think, is it a cheek swab or a saliva sample? It looked really, really easy. I
Yeah, it's a
opened it and
saliva
like
sample.
it took me like 2 minutes to collect my sample.
Yep, exactly. Just spit in the tube, basically.
And I think it's we do a lot of gut testing. So we have our patients submit stool tests to look at the gut microbiome. So I'm sure there's a lot of similarities between the two. So I'm really fascinated to see how we can use that approach with our patients to work on both their mouth and their overall gut health.
Yeah. Yep. There's 7 or 8 categories that they look at. Gut health is one of them. So they
Okay.
do understand and link the common bacteria there.
So back to the xylitol thing. Do you think it's a
Mhm.
good idea to chew something like xylitol gum or suck on xylitol mints after you've had a meal?
I think in general, yes.
Okay.
I think that if you have more information, perhaps not, because xylitol is still sort of a scorched earth sort of approach where we're killing everything and hoping the good stuff grows back.
Right.
So at a certain level, it can do that, and it can do that to the gut.
Yes. Yeah.
So I think in moderation, after a meal, it's great. Like that's the perfect end because you can stimulate saliva flow too, which brings the acidity, the pH of our mouth back up to a neutral level, and the mouth must be in an acidic pH to promote decay, to produce decay. So if we can chew a piece of gum, get our saliva flowing, get that pH back up right after we eat, I think that's definitely a benefit. And then the xylitol certainly can add to that. The bacteria eat it, but they can't digest it. So basically, they just end up exploding.
They just
And
die.
yep, exactly, and can't
Machine gun
cause decay.
approach.
It
So
is.
that kind of ties into mouthwash too. So
Hmm.
I listened to the Andrew Huberman podcast several months ago on
Oh yeah.
oral health. And I mean, I already knew this about mouthwash, but I think it's important for people to know. mouthwash is something also that can be really good for overall oral health and dental health, but it's the type that you choose that's very important, correct? Do you have a recommendation for that?
Yeah, it's the type and it's the timing. Early in treatment to knock some of the bad guys down isn't a bad thing. But typically, I'd say for a short period of time, one phase. Bristle Health gives great guidance on that, and then shifts people to things that will promote a healthy microbiome.
Okay, so it's
Um,
not something you need to use every day if you've gotten to a place that you're in pretty good oral health. Or have
right.
good oral health. Okay.
Yeah. Yep. Yeah. I think surprisingly or not, to maintain a healthy mouth, it really does come down to the things we've always been taught. And it's more about consistency, like so many things, which is great because health can get and recovering health can become so complex.
Right. But you agree not to use alcohol-based mouthwashes, correct?
Exactly.
Like
Yep.
the really astringent, my son loves his. I'm trying to get it away from him, but those are the ones
Yeah.
that are overall just never good to use. You want to use the more natural, non-alcohol based mouthwashes, correct?
Right. Alcohol can be very drying and non-selective, so it has multiple negative effects on the
Okay.
microbiome.
So, what is your take on fluoride? And you don't have to answer if you don't want. I feel like that's such a
Yeah.
polarizing topic, and I don't know
Yep.
how to answer my patients when they ask me.
Yeah. So for me, it's a drug, right? It has a proven oral benefit to counteract decay when we just simply can't figure out the causes. When people are on a lot of medications that cause dry mouth that are keeping them alive, when they just really don't want to take the steps to change their diet or change the underlying causes, it still has a place, but topical. Like all the proof is that it works in a topical fashion, and we know what it does to the body at high enough doses. Um, this is a very timely question because I just received an email yesterday that one of the governing bodies in Florida is calling this into question as far as the link between child IQ and water fluoridation levels. So I wish I would have read that article five
Right.
minutes ago. I could give the update on that, but I see trends like this. I see things happening and small things happening that are progress in that direction. But yeah, so basically, we kind of view it as a drug where, again, short-term use, try to bring things under control, topical only. We don't put it in any of our products, so it's not in anything that's in our office. But if if we jointly determine that that fits the person's goals and values and risk factors, we could write out a prescription or advise it if needed.
So basically, I mean, I'm not saying you're advising this, but it sounds like
Hmm.
you might agree with it that I say you probably should filter your water to get the fluoride out so you're not getting systemic administration of fluoride to the body. And probably not use fluoride toothpaste, maybe use a fluoride-free toothpaste or something a little more natural. Does that sound right?
Yeah, it's hard to make a blanket statement on it. We're so accustomed to have people come in, find out, what kind of products they like to use, what their goals and their values are for health, evaluate their gum tissue health, and then talk about it in a more customized fashion.
Yeah.
So it's hard to make just a blanket statement about it, but I do think there are other ways to approach it. And there still could be a time or place for any individual person. But if people just set that as a preference that they don't want to use fluoride because they recognize the potential systemic impact, water filtration would be a great way to start because you don't really have control over that. And so if you
Right.
can gain control over it in your exposure, that would be one initial step to
Yeah, and
take for sure.
it's hard because I heard of one community where they actually removed the fluoride from the city's water, and then there was actually a lawsuit because the kids in the community started to have more cavities.
Oh,
So if you look at things from a population standpoint, it still might be good to keep the fluoride in the water because there are going to be people who don't take care of themselves and eat a lot of sugar, and it will prevent cavities in that population. So I totally understand what you're saying.
yeah, it all depends on someone's
Yeah,
habits and everything else. So that just goes with the extremes. If
right,
we
right.
just take an extreme approach to everything, it can be really difficult to
Absolutely.
help all the people coming through our door.
Yeah. So with mercury, so I know that you have a mercury-free practice, and I think when we spoke recently, you were saying that most, people are really recognizing that mercury is not a safe substance to use for fillings and things like that. Tell me about the safe amalgam removal. So just
Mhm.
for my audience, when you're removing a mercury filling, otherwise known as an amalgam filling, there is some release of that into the body, which for a dentist who's removing them repeatedly can be very toxic to them, but also it could potentially be toxic to that patient if they have a lot of other toxic burden in their body. So tell me about how you remove them safely.
Mm-hmm. Yeah, so there's really two ways that people could be exposed to mercury. One would be from the bits and pieces of the filling as it's coming out, or in the water that's rinsing the tooth as we do it. And then the other is vapor. So anytime there's friction on a silver mercury filling, that mercury is going to be released. So we cover everything but the teeth we're working on with a rubber dam, so it covers the entire mouth otherwise, so we don't have to worry about them swallowing any of those particles. We give them a clean source of air to breathe, basically just 100% oxygen. And then we use a vacuum below their chin with a mercury filter on it that draws the vapor away to keep that vapor out of our room air and out of their breathing space as well. Then there's just some physical barriers. So we wear gowns, full drape for the patient, hairnet for all of us, charcoal filtered masks or respirator for us. So really just protecting everyone involved from that exposure during removal in every way that we can.
And I'm sure you've seen patients who actually have mercury toxicity. I've had patients in my practice where we've just measured their serum level of mercury and it's been high. One of whom was a patient who had multiple amalgams that had just been removed. So it is really interesting. I definitely see it in my practice, and sometimes you'll see people experiencing symptoms from it, not always, but definitely something I've seen.
Yeah. Yep, it's hard to draw the connection between the two if they don't have any symptoms. We can never guarantee, you're going to receive this sort of result, but
Right.
I think at this point in time, with what we know, it's important that we use all the precautions we can when we do swap those
Right.
fillings out.
And it's nice that it's you can actually get rid of it from the body. There's specific practices you can do and things you can take to help get the mercury out of the body. So if you're already someone who's had your fillings out, or you still have fillings and you're worried about that, you can get your blood tested and you can do some things to help get rid of the excess of mercury in your body, which is not that hard.
Yeah. Yep. And someone is considering it, certainly not just look into the dental removal, but all the things that you mentioned, and working with a practitioner like yourself that can help them remove that and eliminate it from their body as well.
So do you have a recommendation for people if they ask you what kind of toothpaste to use? I know that's a really boring question for you, but I'm
Yeah. There's several that we like. There's a toothpaste called, if I just have to give one answer, there's a toothpaste called Revitin. And it's made by Dr. Jerry Curatola, who he's a pretty well-known biological dentist, and he developed that product, put a lot of thought into it. It's so safe you could even ingest it as a supplement. But it does have probiotics, prebiotics. The products in it are going to, in general, promote health. It's a little pricey, but yeah, if I have to pick one, that would be it. Otherwise, we kind of, again, base that more on risk factors and what we're trying to achieve.
right. Huberman had mentioned hydroxyapatite as being something that can actually rebuild enamel. Is that a true thing that you have seen in your practice?
Yeah, we've just started to introduce it in the last 6 months,
Okay.
both in the form of varnish and then recommending it as a toothpaste. It's new, and so we're waiting to see if it is on par with the other remineralizing agents that we've been using to help keep early cavities from progressing or remineralize. Some people do have concerns that it's a nanoparticle, and as far as we can tell so far, it's not one that's crossing the blood-brain barrier, but that's certainly something we're paying attention to as well.
Absolutely.
But it does seem to have a potent potential.
So is it possible to reverse small dental caries or cavities?
Yes.
Or,
Or at least keep them the same. So in the enamel's over 99% mineral. So the enamel is our opportunity. If it crosses over into the middle layer of tooth, where there's complex architecture, all sorts of different molecules and structure that's very complex, that's not just going to rebuild itself. So our opportunity is when the decay is still in the enamel. So we are very slow to mechanically treat, meaning drill and fill cavities that are in the enamel, in an effort to try to remineralize. And that strategy does involve x-rays each year to make sure nothing's changing. That's really the only way we can see how far it's penetrated. But yes, then using things like hydroxyapatite and remineralizing agents, and just what coaching we can provide to help them turn the tide of that decay process.
When someone is asking you, I have a couple of specific questions. So one is on toothbrushes,
Hmm.
soft versus hard, and electric.
Hmm.
And then also, obviously touch on flossing because I think that's important that everyone should hear about. And then third thing I want to talk about, care of gums and tongue. So starting with toothbrushes, what do you feel about
Yep.
toothbrushes?
So
Or is that
definitely soft.
okay?
Yep. Yeah. So if you can use just a manual brush, just a typical brush, go with something softer versus hard. Um, Small circular strokes versus real hard, aggressive back and forth brushing. The risk there is that over time you can wear at the enamel, you can wear at the gum tissue, create recession. So it's one cause of recession of the gums. Manual versus electric. So there isn't any tool in our practice where we see better results from one visit to the next in the levels of plaque than if people implement an electric toothbrush. It just becomes so much less technique sensitive. And we chart these things. So we actually have a program that will graph their results with plaque and bleeding over time. And we just see these real vertical trends with plaque scores as soon as they implement that electric toothbrush. So
Oh,
Sonicare
interesting.
is the one we usually go to,
Yeah.
but really any of them do that job,
Oh,
and
I
we see
might
that
change my
result.
practice. I hate having to recharge my toothbrush, so I've been just sticking to the manual ones, but I probably should switch over.
Yeah, yeah, it's there's a little bit more to it, but um, even just the fact that it has a timer on it and
Right,
it kind of encourages people to and almost requires that they brush for 2 minutes.
right,
That's as powerful as the technology, any other technology in it. But
right.
yeah, for all those reasons, that's why we see the results.
And do you flossing once a day okay, or do you like twice a day flossing?
Once a day is great. If we
Okay.
can get it in there and disrupt that biofilm in between, that's usually adequate. Go for more if you can, and it doesn't matter what time or what sequence. We can get into those details. That's more the graduate level, but
Right.
keep it in your car. It doesn't matter. Whenever you're going to floss, just get in there once a day and disrupt that biofilm in between the teeth, that plaque in between the teeth, and you're going to get the benefits.
And when you're brushing, do you agree with going up on the gums a little bit and stimulating the gum tissue with the brush as you're brushing your teeth?
Yeah, so the best way to do that would be to angle those bristles at about a 45-degree angle and sweep along the gum tissue so that you're contacting the crevice between the gum tissue and the tooth. That's where the plaque collects, and then you'll get some stimulation of the gum tissue at the same time.
And I know it's such a stupid question, but I think for a long time I even just brushed my teeth only and just kind of never thought about it. And then as I get older and I'm like, okay, maybe I want to like take care of my mouth a little more. It's just something I never even thought of and something that my dentist had never told me, or maybe they had and I didn't listen to it. But um, and then there's all this stuff in the health and wellness industry about tongue care. So like there's oil pulling, there's the the brushes or the tongue scrapers you can use.
Hmm.
How do you take care of your tongue? Is it really that big of a deal?
Yeah, because if we could be brushing the rest of our mouth perfectly, but the tongue with all its geography and little nooks and crannies is a great place for bacteria to hide and then repopulate those areas as soon as we're done brushing. So it's important that we clean our tongue. The best device to do so is a tongue scraper, and it's a
Hmm.
super simple tool. It's just basically like a straight edge on a handle, and
Hmm.
you drag it across your tongue. But the best way to do that is start from the back and work your way forward. And before you make another pass, rinse it off. So do that 3, 4 times or so, front to back, excuse me, back to front, rinse it off in between each rep. And that's yeah, again, doesn't matter which sequence it is in with the rest of your routine, but if you can incorporate that, you'll definitely enhance your results.
Okay, I love it. And then also, what would you tell people if they said, "Hey, what are the top, 3 to 5 things I should avoid if I want to keep my mouth healthy?" And I can prompt you a little bit because I have a list of what I would say, but I want to
Yeah,
hear what you have to say about that.
sure. Number one, as hard as it is, sugar.
Yes.
Yep. Sugar is the gum disease, whether we're talking about the gum disease bacteria, decay causing bacteria, or just the microbiome overall, candida, any of it, sugar is the biggest thing. It's hard. I mean, we have been so accustomed to in to take sugar in, and with the whole fats are bad and
Oh, I know.
eliminating those and all processed food, then introduce more sugar, more processed carbohydrates, as children of the 70s, 80s, and 90s. I mean, that was just what was available to
Yes,
us.
I like bathed in sugar for the first half of my life.
Me too. Yeah, I'll admit it. We didn't know. It was just
So
the way that
bad.
we were conditioned.
Oh,
Yeah.
when I was in college, that was the whole like fat-free craze. So
Yeah.
we would our what some my roommates' parents would send us boxes of Snackwell baked goods, which were all fat-free, sugar-based, like cookies and whatever.
Yeah.
And then I would eat Twizzlers because I was like, I can eat whatever I want as long as there's no fat in it. It was terrible.
Yeah. Yeah.
And
So we could get into all the reasons why we're addicted to sugar, and it's addicting, but
yeah.
that's really the biggest thing.
Yeah, and I think the whole thing with sugar too, it's nice because it's not only going to affect your oral health, but obviously it's going to affect your overall physical health. It's going to affect your
Hmm.
mood. It's going to affect your sleep at night. I mean, we could go on and on about that, but
Yeah.
how do you feel? As a physician, I know alcohol is super toxic to the gut and the esophagus and the stomach. Obviously, super toxic to the mouth as well.
Hmm.
Do you see that as well?
That's a really good question. I
Or is it
actually
more
haven't.
so in like the heavy drinkers? 'Cause I'm thinking more of like the really heavy drinkers where they have ulcers and they have, beefy red mucosa and
Yeah.
that. But is moderate amount of alcohol bad for oral health, or do you think it's okay?
That's a really good question. I don't think I have a good answer
No,
for
and
that
that's
one.
fine. That's fine. I just did a podcast on alcohol that I don't know if it'll come up before or after this one, but I'm just curious about that because it's definitely something I saw in my practice, but I haven't heard a lot about like normal casual use of alcohol and how it affects the mouth. Um,
Hmm.
I think obviously you would agree that things like meth and stimulants affect the mouth in a pretty negative way.
Oh, yeah. Yep, for
Um,
sure.
you probably don't see a lot of that in your practice. When I was doing my emergency medicine residency, there's a lot of meth in Southern California, and meth mouth was
Yeah.
rampant.
That's where I saw it as my first year in that general practice residency.
Yeah,
It's incredible the damage that it can do.
yeah. So stimulants, caffeine, I would think is probably fine for your mouth. Do you do a lot of work with people on mouth versus nasal breathing, or is that not something that you've incorporated into your practice?
Yeah, I think that's really one of the foundational skills people could incorporate for decay, because mouth breathing does definitely shift that microbiome and causes a more acidic environment. So we do see kids in particular. So there could be a family of six, and five kids are cavity free, and one kid has just rampant decay. And what we see in our practice is that usually the one that has the decay, the difference is mouth breathing. So enlarged tonsils, adenoids, that type
Right.
of thing.
They kind of have that.
Yep.
Yep.
Yep. So
Yeah.
adults, we tried to teach that right away, particularly if it's an issue, and talk about those skills from that standpoint, but also just to help them get into more of a parasympathetic tone, because they'll be less likely to clench and grind their teeth if they can do that. So
Absolutely.
from multiple fronts, that's really a foundational dental habit.
Yes, I love that. I love that. I've been trying to learn a lot more about that. Not only about it, but how to get patients to transition from mouth breathing to more nasal breathing for that exact same reason. It's for that parasympathetic sympathetic tone and
Yep.
how that affects the rest of their system as a whole. So I love that. Um, is there anything I didn't ask you that you think my audience should hear about, whether it's about dentistry, oral health, anything I didn't touch on?
I think the biggest things are, if you hear something on the internet, don't panic.
That's a good
There's a
one.
lot of, yep, there's a lot of blanket statements that are made, and a lot of just cut and dried extreme approaches and statements that can be made. And it can be overwhelming because you hear 20 different things that you must do now for your oral health. And that's really where we've tried to position our practice, is people can bring those concerns in, but we want them to just slow down, help them to confront the reality of the situation, help them to pick through those issues that are concerning for them, and just allow them to prioritize, figure out what's actually relevant to their situation. So help them to see a window into their health. So basically, we want to learn from them what their goals are. We want to help them see for themselves where they are right now. And we put those two pieces into place and just kind of calms everything down. And now we can just pick action steps and prioritize, address things like layers of an onion, and just comfortably work through things. So I think that's the biggest thing. We're exposed to so much information, and it's not all, I'm not saying it's all wrong, it has, necessarily, but it's just a lot to try to process. And the
It's a
people that
lot.
get results don't necessarily have to do all of it.
Right. It's a lot, and if you do everything that you hear on the internet, whether it's for your mouth or your whole body, you're gonna have a full-time job doing self-care.
Yep,
So
exactly.
I totally agree with you. I mean, even after I listened to that Andrew Huberman episode on oral health, I had to go through the transcript, make notes, and I had all this information. And at the end of the day, I was like, okay, this little bit of stuff makes sense for me to do in my life, but the rest of it I'm probably just gonna put by the wayside. And that's me as a trained medical provider going through the data. So, and these are, I mean, he has millions of viewers, so I totally agree with you on that one.
Yeah. Yep. That's so true.
And so lastly, I always like to tell people how they can find you, which I kind of hate to do because I know you're already so busy that it's not like a bunch of people can come and flood your practice because you're already very full. But as I said, you're located in Howard.
hmm
We'll put his website in the show notes. You're not super active on social media, right? You don't have like a big Instagram account or Facebook, or is there one that we could put on there?
We do. It's not very active. As we've
Okay.
gotten busier, we just kind of stopped all
You're just seeing
marketing.
patients, right? That's what I
Yep.
figured.
Exactly.
And I totally understand that. So the best place probably to find him is going to be at his on his website. And then I would say I want to just add this that, if you're someone who's like, "Oh my gosh, this dentist sounds great. I'm in the Green Bay area. I would like to go there." I would ask patients, are you someone who's proactive, willing to work on your overall health? Because I think you want to be a good fit for the practice and you're already really full. So you want to be someone who's already willing to make some specific changes to your health and your wellness and your oral hygiene that makes sense with the vibe of your practice.